Welcome back to Inside City Hall. The pandemic has revealed just how important child care options are for working parents. In an effort to make sure that all parents get access to affordable child care, Mayor Adams recently released a plan that includes a $2 billion investment in early child care spending over the next 4 years. The plan also prioritizes getting services to high-needs neighborhoods and creating a career training pipeline and supplying vouchers for undocumented families. Here to talk more about the plan is Jennifer March, the Executive Director of the Citizens Committee for Children. Welcome back to the program. Good to see you.
Thanks for having me.
Absolutely. The city says that there are about 500,000 kids under the age of 5 in New York City, and that about 315,000 of them are in families with income that makes them eligible for some level of subsidy. I know this is something that you were tracking in the run-up to the city budget. How did we come out when it comes to providing additional child care for those needy kids?
So we know right now that the city's subsidized system of childcare and early education reaches about 126,000, has capacity to reach about 126,000 children. This childcare plan would add 41,000 seats, so it would reach an additional 41,000 children. So it really is an ambitious start to a path to universal childcare in this city.
Where is the bottleneck? Is the problem with making people aware that the services are there, or is there a need to subsidize more centers, or is there a staffing issue? Why do we have such a big gap between what's available or what we hope for and the great need that's out there?
So there are a couple things. I mean, the city has always had one of the largest subsidized childcare early education systems in the country. Largely because we have the largest child population in the country. I think for us to really get to true universality in New York City, we need a greater partnership from the state and federal government. I mean, the city spends an enormous amount of city tax levy on universal pre-K, 3K, and childcare. And this plan leverages new state dollars that were secured in the last state-adopted budget, but we need to go farther, really in partnership with our state and federal officials to make universal care a reality. That said, you know, sometimes, and particularly as we come out from the pandemic, care that exists goes underutilized, and that is for a wide variety of reasons that we're really trying to get to the bottom of now.
And to the extent that you have any kind of a handle on it, is the idea that people know that the service is there but are affirmatively deciding not to use it, or is it about them not knowing, or is it do we need to reconfigure the service so that people can make better use of it?
Well, I think right now what the biggest challenge that implementing this plan faces is that we are trying to stabilize the childcare sector and expand access at a time when the city is trying to recover from a pandemic that had profound public health impacts and economic impacts on people. So the childcare sector was shuttered from the spring of 2020 and the greater part of that academic year. And as it reopened in 2021, we were experiencing a lot of challenges engaging families and kids in services because many households lost employment, lost income, right? And there were also really serious concerns about care for a population of children that wasn't yet eligible for a vaccine. Mm-hmm. So I think a combination of things have really caused a dip in enrollment among existing capacity now. And what this plan really tries to do is bolster education, outreach, and reach populations that we know are in desperate need of care, whether it's immigrant households, children in shelter, children in high-need communities. And I think that that's a great start.
Yeah, I see that the city is going to invest, they say, $10 million to provide access to subsidized childcare for children whose immigration status would make them ineligible for state or federally funded subsidies. And that, of course, includes undocumented children. That in New York, that could be a really sizable number of kids, right?
Yes, and they do other things too. In the plan, there are legislative proposals that would need to move at the state level that will kind of reduce barriers to access for other types of households. So right now, you don't qualify for child care subsidies if you work but fail to make at least the minimum wage. Which is, just the population we'd want to actually help support for childcare. There are also barriers to care that has to be tied to working hours rather than any hour a parent might need care. So there's some legislative proposals that are really designed to make sure that the childcare subsidies can be used by parents when they need them, which would also help us engage people.
Right, I see. Yes, I noticed that something that you had called for in the city budget when it comes to housing, which is a key component of all of this, you concluded that it falls short of what the mayor had promised for affordable housing infrastructure.
Yes, the CCC and the Family Homelessness Coalition felt that the housing plan really needed to go farther to create more affordable housing and housing access, in particular for families.
Yeah, I mean, I only raise that because, ultimately one of those questions has an answer about why more people aren't using the services, and it's because maybe they're worried about keeping a roof over their heads, right? So that childcare might seem like a bit of a stretch if they don't know where they're going to be spending the next night. Yeah,
and I think, people in coalitions around child and family policy, whether you're talking about child welfare services and preventing the need for preventive services, or we're talking about housing stability or school preparedness and helping parents get back to the workforce, childcare is really a central ingredient in household stability, as well as housing.
Well, we are glad we have you to walk us through some of this. We're going to keep an eye on this because it is so critical for so many families. Jennifer March, thank you so much for joining us.
Thank you.